Yeah. Okay, we're
Yeah.
back.
hmm Okay, sir. So for this time, what topic do you like us to talk
Yeah.
about?
Okay, I'd like to talk about the number 1130.
Okay. Ooh, 100 babies.
Yes, right. Okay.
Okay, sir.
So, more than 100 healthy babies have been born to mothers infected with the novel coronavirus in one hospital in India's western city of Mumbai.
hmm
Three of the 115 babies born to infected mothers at the Longmanya Taki Tilak Municipal General
hmm
Hospital in the past month initially tested positive for COVID-19, but subsequently tests cleared them, doctors said. Two other infected pregnant women died at the hospital, including one who died before her baby was born. With nearly 20,000 reported infections and more than 730 deaths so far, India's financial and entertainment capital has become the epicenter of COVID-19. More than half of the babies born to infected women at the hospital, also called Sion Hospital, were delivered through C-section while the rest were natural births. Officials said 56 of them were boys while 59 were girls. 22 of these infected mothers were referred to from other hospitals. It is not clear whether the majority of these women contracted the infection at home, outdoors, or in a hospital ward. A team of 65 doctors and 2 dozen nurses have been treating these COVID-infected mothers in a 40-bed special ward. With the surge of infections, the hospital is planning to add another 34 beds for infected pregnant patients. The deliveries are happening on half a dozen tables in tourist operations theaters, where doctors and nurses and anesthetists are using protective gear. After giving birth, the mothers remain in the special ward for COVID-19 patients for a week and are administered hydrox- hydroxychloroquine. After that, they are quarantined up to 10 days in a separate center. The babies are not isolated and are breastfed by mothers wearing face masks. Mother to child transmission of the virus in the womb or the time of delivery prior to contact of the infection with the mother's respiratory secretions is rare. Dr. Adam Reitner, the director of pediatric infectious disease at New York University School of Medicine and Hassenfeld Children's Hospital at NYU Langone Health told me, this is of course with a caveat, he says, that this is a rapidly changing situation and new data may arise. Dr. Reitner says there is some emerging data that suggests that the novel coronavirus can be detected in placental tissues. That's all. So,
Okay, this is
yes,
very interesting.
I have a question. In your
Yes, sir.
countries, the rate versus of natural birth versus C-section, which
hmm
one is more common to your country?
I think, sir, the natural delivery is more
Uh,
common.
that's more common. Then what about in
Yes.
your case? Did you deliver
Normal
your
delivery, sir.
normal delivery? So isn't that very painful?
Yes, sir. It's very
Oh,
painful. I can literally feel
yeah,
my bones
yeah.
cracking on my back.
Oh,
Yeah, when the baby is coming out, you can
yeah,
really feel that something is spreading
spreading.
behind you.
Yeah.
Yeah, so
So
painful.
so you got some anesthesia,
Yes, sir.
right? But you
Yes,
can
sir.
feel the pain.
Hmm.
But
Yes,
after
sir.
giving birth, how many days you need to be a normal life?
In my case, sir, after 4 days, I
Yeah.
feel okay.
Uh,
Hmm.
then what about the intercourse?
Eh, oh, sir, I am so scared after I gave birth because I had a very painful labor.
Yeah, yeah,
So, yeah, I think after 3 months,
yeah. After three
I'm not
months.
really. Hmm.
So that was good or
Yes,
not?
sir.
Uh,
No.
no, not good.
It's so painful.
Yeah. So I
Hmm.
just wonder what's the feeling before giving birth and after giving birth, after 3 months later. But now, what's the feeling?
It's real right now, sir. It's normal. It's like before the pregnancy, but
Yeah.
um after I gave birth, it really feels painful. It's like there is a burning sensation inside my body. And then my
Mm,
doctor said that it is normal because the body inside the body it's not yet healed.
inside your
Yeah.
body. That,
Yes.
yeah.
Hmm.
So you don't have any plan to have another baby.
Right now, sir, no, because it's really difficult because of coronavirus.
Yeah.
So there are a lot of pregnant women dying in
Ah,
our country because they cannot deliver their babies in the hospital.
yes, right. Oh, that's a
Hmm.
very sad story.
Yes, sir. Hmm.
Okay.
Okay. So now,
So,
sir, let's
yeah.
start with our
Comprehension.
comprehension question. Number
Yeah.
one.
Number one, how many infected pregnant women died in the hospital?
Hmm.
Actually, how many? Actually, 730 deaths so far were infected in India.
Hmm. Yes, sir. There are a lot of women who died.
Yeah,
Oh, 733, 30 deaths.
yeah, yeah.
Hmm. Yes. Okay. And what about number two, sir?
Number two, what is the name of the hospital? The name of the hospital is Sion Hospital. We call that Sion Hospital. Actually, I've been to this hospital last year,
Oh,
Sion
what did you
Hospital
do
in
there, sir?
Mumbai. So to have a meeting with a famous doctor in Sion Hospital and
Mm-hmm.
to introduce my company's surgical laser devices.
Mm-hmm.
So I visit there. Actually, the Sion Hospital is a kind of public hospital, and there, even though it's a really big general hospital, but it's very outdated, and then there are lots of patients, poor patients
Mm-hmm.
there.
Oh, okay. Thank you, sir, for sharing your experience when you saw that hospital in Mumbai.
Yeah.
And what about number three, sir?
Number three, out of the 115 babies born, how many tested positive for coronavirus?
Mm-hmm.
Mm, tested positive. Actually, the tested positive for coronavirus case is very rare. So the number is not mentioned in this article, but maybe less than 10 or more, yeah, less.
Mm-hmm. Oh, yes, sir. It's not really directly
Yeah,
mentioned in the article.
yes,
Mm-hmm.
right. Okay.
Okay. And let's proceed to discussion question, sir.
Number
Number
one,
one.
yeah.
Mhm.
Do you think wearing a face mask while breastfeeding guarantees the baby's safety? Explain your answer.
Mhm.
I think wearing a face mask is not enough to prevent to infect the baby, infect coronavirus to your baby while you are breast
Mhm.
breastfeeding because
Mhm.
you can touch you if you touch your babies or through your body or through your clothing,
Mhm.
the virus could remain anywhere around you. So
Mhm.
even though if you wear the mask, so you should not to touch or you should keep the distance from your
Mhm.
baby.
Yes, you are right, sir, because they said the virus can be transmitted 13 feet from one another. What more if you are carrying the baby, right?
That's why.
Yes. And now,
Okay.
sir, what about number two?
Number two, do you think they should isolate the babies? Why or why not? Of course, I think they should isolate the babies.
Mhm.
Not not only in that room, and also the baby should isolate it from outside the
Mhm.
hospital. Because there are lots of potential virus around the hospital, so they should
Mhm.
be isolated far away from the hospital.
Yes, that's right, sir. And the last question, sir.
Yeah. Number three, do you agree the mother to child transmission of the virus is real? Why or why not?
Mhm.
So I agree with the idea the mother to child transmission of the virus is real because
Mhm.
once I, from my knowledge, if the through the natural birth, the baby is goes through your
Mhm.
womb to your vagina,
Mhm.
then it's naturally immune by the
Mhm.
lots of germ in your vagina and then womb. Then there could
Yes,
be
sir.
there could be a natural immune. They could make natural
Mhm.
immune system.
Mhm.
So
Yes,
even
sir.
for the coronavirus patient's mother, then they might have some kind of antivirus in your
Mhm.
in the mother's vagina or anywhere.
Mhm.
So the baby could
Yes.
some kind of antivirus
Mhm.
antivirus in it.
Yeah. It can adopt, right, sir? It can adopt right away to the mother's
Yeah, yeah,
body. It can produce
yeah,
its own antibodies to fight the virus of the mom.
yeah, yeah.
Mhm.
Very natural ways. So
Yes.
there could be a yeah, there could be a good way, or there could be another treatment or vaccine
Mhm.
for the newborn babies.
Yes, you are right, sir. And then they are saying the plasma of the
Yeah,
recovered patients, right?
yeah,
You can use that to cure the person suffering from coronavirus.
yes, right.
Yes, sir. So we are done with this
Yeah,
one, sir.
yeah. So
Yes.
we can meet in 4 minutes later.
Yes, sir. See
Yeah.
you after 4 minutes.
Okay, see you.
Bye bye, sir.